Let me move again, Dr. Holtz-Eakin, with you to drug pricing. Driving down premiums and expanding coverage requires us to tackle not just the price of insurance products, but also the underlying cost of care. When we look at the key drivers of healthcare spending growth, there's no doubt that certain specialty prescription drugs have a substantial impact, at least when they first come to market. That said, as the nonpartisan Congressional Budget Office has repeatedly noted, medications can also play a crucial role in reducing costs elsewhere in the healthcare system, including at more expensive sites of care. Moreover, once products go off patent and their exclusivities expire, the prices generally drop dramatically. And I would note that currently more than 90% of all prescriptions are filled with generic drugs, not patent-protected brand name products. The House Democrats' proposed drug pricing controls, unfortunately, would undermine the current balance, drastically reducing the number of new treatments coming to the market and deterring innovative R&D. In your view, Dr. Holtz-Eakin, what impact would the House drug pricing proposals have on healthcare access and quality, and what type of policies do you see as the right ones? I know you touched on this talking about Part D in your statement, but would you just respond to that generally?
Yeah, certainly. I'm quite concerned about the proposals that were in H.R. 3 and are now in the Ways and Means passed legislation. Those proposals essentially, the international reference price is a price control. The supposed negotiation with the Secretary of HHS is really not a negotiation. The threat is a 95% sales tax on domestic sales. It's not deductible for income tax purposes, so the effective rate's over 100%. So essentially, you have the Secretary in a position of being judge and jury and just demanding the price they want. We know from looking at other countries that while prices are lower, access to medicines are much more limited. In many cases, the most innovative therapies don't arrive for 2 and 3 years, if they arrive at all. In many cases, they don't. In the U.S., 90% of innovative therapies are on the market in 3 months, and people have access to care. And so while it looks like those other countries aren't paying much, they are paying for it in less high-quality care, less access to the most innovative therapies. And I think the reforms that I outlined on Part D would be a very good starting point. They are bipartisan in nature. They've been in legislation proposed by Democrats, legislation proposed by Republicans. Presidents have supported it. They would improve the negotiation incentives in Part D and thus lower prices broadly and spill over into commercial markets as well. And they would protect seniors from catastrophic costs, and that's overdue. So I think that's a good place to start. It doesn't threaten the innovation in the system. It does promise access to high-quality drugs for our seniors.
Thank you.